Hello everyone, this is Jennifer's group with Linda and Mia. For the project, we're going to talk about working memory related to language among stroke people. And for the language, we have three perspectives, which are verbal language, visual language, and auditory language. For the first part, verbal language, I'm going to share three articles with you. The first article is Rehabilitation of Verbal Working Memory After Left Hemisphere Stroke, and the variable of mental process is verbal working memory. And the issue or problems researchers try to investigate further is to assess both the efficacy and the specificity of a working memory therapy, which was designed within a Bartley's theoretical framework in a patient with a chronic stroke suffering from a selective impairment of the central executive and the phonological loop. There are three methods to measure. The first one, cognitive tasks specifically designed to assess the different components of working memory. The second one, related verbal complex tasks. For example, tasks that were not specifically designed to assess working memory, but that nevertheless included a high working memory load, text comprehension, and arithmetic problem solving. And the third one, ecological questionnaires designed to assess the consequence of working memory deficit in everyday life. And the outcome of the discussion is the results suggest that the training resulted in a specific improvement of verbal and attentional aspects of working memory, with a generalization to untrained tasks and a transfer to everyday life skills. And it was also found that improvement was limited to the subcomponents of working memory which had been specifically trained, verbal and executive, while visual working memory, which was not addressed by the treatment, remained unchanged. In conclusion, the present study suggested an effectiveness of a specific therapy focusing on verbal and central executive aspects of working memory and its generalization to daily life activities. And the suggestion for the future research is that future study could address the specificity of therapy on different components of working memory. And here are the 8 rehabilitation methods and the cognitive tasks. You can take a look. And Article 2 is Assessment and Treatment of Short-Term and Working Memory Impairments in Stroke Aphasia, a Practical Tutorial. The variable of mental process about this passage is spoken and or written language working memory. And the problem researchers try to investigate further is to examine the association between language and short-term and working memory impairments in aphasia, to describe practical ways of assessing short-term and working memory function that could be used in clinical practice, to discuss and critically appraise treatments of short-term and working memory reported in the literature. The method researchers use to measure is taking a translational research approach. This paper provides clinicians with current evidence from the literature and practical information on how to assess and treat short-term and working memory impairments in people with aphasia. Published treatment of short-term and working memory in post-stroke aphasia are discussed through a narrative review. And the outcome of the discussion and measurement is the links between short-term and working memory functioning and language in aphasia are generally acknowledged. These strongly indicate the need to incorporate assessment of short-term and working memory functioning for people with aphasia, while the supportive evidence for treatment is growing and appear to highlight the benefits of including short-term and working memory in aphasia treatment. The quality of the evidence in its current state is poor. However, because of the clinical needs of people with aphasia and the prevalence of short-term and working memory impairments, incorporating related treatments through practice-based evidence is advocated. And the suggestion for the research is, having discussed in theory, assessment and treatment descriptions together with a critical evolution of treatments, we would like to encourage clinicians to strengthen the evidence of this novel and likely promising avenue of clinical research. And these are the how to do the tasks. You can take a look at the tables. And this is the short-term memory tasks. And for Article 3 is transfer effects on spoken sentences, sentence comprehension, and functional communication after working memory training in stroke aphasia. The variable of mental process about this passage is verbal communication and working memory. The issue or problems researchers try to investigate further is, does working memory training transfer to cognitive domains targeted by the training but measured by untrained tasks, for example, near transfer in individual with aphasia? And does working memory training transfer to spoken sentences comprehension, functional communication, and everyday memory, for example, far transfer in individual with aphasia? Are training and transfer effects maintained over time, for example, at 4 to 6 weeks follow-up? And do motivational factors play a role in individual with aphasia's working memory training performance? And the methods they use to measure are multiple baseline with control experimental design, and which has two parts. Part A is a visual and back task with pictures, and part B is an auditory and back task with spoken words. And the second one is data analysis, analyzes performance change in the training tasks and outcome measures, and also the inter-reader reliability test. Okay, so for the results suggest that working memory can be improved through computerized training in chronic aphasia, and this can transfer to spoken sentence comprehension and functional communication in some individuals. And the suggestion for the future research is the baseline variability was too large to provide stable baseline estimates, which could have led to some outcome effects overestimated or going undetected. For these conditions, therefore, both significant and non-significant effects should be interpreted with caution. In particular, experimental tasks used for multiple baseline assessment can benefit from more baselines. And the second one is for sense versions test. The future research with a larger number of examples of each sentence type might allow for a better understanding of the underlying mechanism of transfer effects on sentence comprehension.
So this is Mia. About Article 4, consequence of stroke for feature recall and binding visual working memory. Is variable of mental process, it is visual working memory. And there are two issues or problems researchers try to investigate further. The first is to investigate whether stroke affects visual working memory in cases where perception is bad. The second is to examine whether stroke can result in specific impairments or feature banding in working memory, that is, the ability to memorize which visual features belong to the same object. And method they use to measure includes participants' paradigm behavioral data processing, neural binding mental model, extended neural binding model, statistic analysis, neuroimaging, lesion analysis, and data availability. An outcome of the discussion and measurement. The first is stroking patients showed an overall decrease in memory precision for both color and location. The second, working memory representations are widely distributed in the brain and can be found across parietal, temporal, and prefrontal cortex. A suggestion for research, because evidence for deviations from the predicted relationship between report precision and soft errors is limited. It should be tested further. And about Article 5, are visual working memory and episodic memory distinct processes? Insight from stroke patients by lesion symptom mapping. Variable of mental process is visual working memory, and there are two issues or problems researchers try to investigate further. The first is to determine how visual working memory and episodic memory performance are related in an unselected cohort of stroke patients. The second is to investigate unique and shared lesion location associated with visual working memory and episodic memory. And the method they use to measure includes story design, memory assessment, imaging data acquisition, lesion segmentation and processing, multivariate lesion symptom mapping, atlas-based lesion symptom mapping, track-based lesion symptom mapping, and statistical analysis. Outcome of the discussion and measurements. The first is stroke can result in both visual working memory and episodic memory deficits. The second, independent regions are stronger associated with visual working memory and criterion citing in episodic memory. Suggestion for research. Because people with stroke might have a higher vascular burden that is related to memory function, there might be a selection bias in the sample, with patients with mild symptoms and small lesions being more likely to participate in research. Hence, in order to eliminate the deviation, wider samples are needed. And Article 6, prefrontal cortex and basal ganglia contributions to visual working memory. Variable of mental process is visual working memory, and the issue or problem researchers try to investigate further is to test the prefrontal cortex and the basal ganglia interact within a cortical and subcortical network supporting visual working memory. Methods used to measure include participants' electrophysiological recording, behavioral task, and data analysis. And the outcome of the discussion and measurement is the prefrontal cortex is critical for top-down interhemispheric modulation of attention and visual working memory, with the basal ganglia involved in global support of visual working memory processes. Suggestion for research. Because although patients in the basal ganglia group understood the task, they had difficulties engaging the neural mechanisms to correctly perform it. In order to have a more exact result, a basic understanding of performing for patients is needed. Okay, this is my part.
About 3 articles about auditory. First article 7. Okay, this article is about 20 patients and 14 control participants were included in the study to ensure that the auditory cognitive deficiencies after stroke may concern language or music processing, resulting in aphasia. Okay, first, let me see the variable of the mental process. The participants listened to an auditory S1, which considered all full events, words or tunes, followed by 1 second silence and then a second sequence S2, in which the full events were the same or different from S1. Okay, and the aim of this present study was to assess that the potential deficiencies of the audition short memory for verbal and musical material for after stroke. And their underlying cerebral correlate with a workspace listen sample mapping approach is called VLSM. And then we see the methods they use to measure. Tested with a detailed neuropsychological assignment, including global cognitive functions, music, perception, and language tasks. All participants then perform verbal and musical auditory short-term memory tasks that were implemented in the same way for both materials. And then the outcome of the discussion. Behavioral results show that the patients had lower performance for the short-term memory tasks in comparison with control participants. Okay, the suggestion for research, we suggest involvement of more virtual areas in musician short memory, and is that warrants further testing. Okay, this is the Article 7. Next, we look at Article 8. Article 8, the variable of mental process is they wanted to control for the various components of digit span that are not specific to auditory short-term memory capacity. To this end, we included data, repetition, word and non-word, verbal fluency, and picture meaning. And for number 2 is the issue or problem. If patients existed who have poor auditory short-term memory, difficulties in the presence of normal speech comprehension, they do have problems comprehending longer, more complex sentences. And the method they use to measure is that competing series of short-term memory function make specific predictions about the foundational anatomy of auditory short-term memory. And it's through in language comprehension, we analyzed the high resolution structural magnetic resonance imaging from 210 stroke patients and employed a novel Wix-based analysis to test the relationship between auditory short memory and speech comprehension. Okay, let me see the outcome of the discussion. From this, we conclude that city of auditory short-term memory is an important factor in determining sentence level speech comprehension ability. Okay, for the suggestion for this research, study need to provide novel data in support of the shared substrate for auditory short-term memory and speech comprehension. Okay, this is all about Article 8. Next, let me see the Article 9. In Article 9, the variable of mental process is all subjects underwent proton oximetry and the emittance measurements. Issue or problem. The present study aimed to characterize the classify and hearing impairments using a detailed ordinal assessment test battery in order to determine the level of criminal need and inform appropriate rehabilitation for this patient population. With the method they use is they assess hearing impairment detail in shock patients by means of detailed baseline auditor very detailed nonverbal audition processing barrier, including the gas in noise test. Is called JIN, and compared to individual without stroke. And next, the outcome of the discussion, the most common type of hearing impairment in stroke subjects was the combination type. In the 61 to 80 years old subgroups, it's 55%. And the 18 to 60 years old is 40%, which were both significantly higher than in contrast. For the suggestion for research, it is essential to identify hearing loss and deficient people and control defections for the evolution and rehabilitation of stroke patients so that an effective intervention for this population can be reached. Okay, this is all my share about the 3 articles. Thank you.
Okay, so for the objective of the study is the primary focus of our study will be on the rehabilitation of working memory among stroke people. The methods of therapy will be mainly focused on verbal language, visual language, auditory language of the working memory part. And the research question is, can the interference theory of working memory related to verbal, visual, and auditory language work successfully among stroke people? And we have 3 hypotheses. The first one is rehabilitation program of attention related to working memory among stroke people can improve their verbal language ability. And hypothesis 2 is the defect of visual working memory can be rehabilitated among stroke people. And the hypothesis 3 is working memory training can improve resolution ratio and sensitivity among stroke people. This study will use a multiple baseline with control experimental methods. Participants will be randomly assigned to the order of the training blocks. Initial assessment will be used to assess suitably in the study. Pre-test and post-test will take 2.5 weeks each, and the training blocks will take 2 to 3 weeks each. The study will altogether around 10 weeks, around 30 sessions. After completion of the post-test, there will be a 4 to 6 weeks follow-up questionnaire. And we're going to use rehabilitation methods as well. Candidates will receive 3 2-hour training sessions per week for 3 months. After the training, a questionnaire will be taken. And look at the table. This is for the method 1. And this is the 2 and back tasks for pictures and spoken words with lures. You can take a look. And here are the 6 rehabilitation methods. We're going to use SPS, this software, to analyze our data, and we're going to do performance change in the training tasks and outcome measures, and we're going to run Fisher's exact and Kappa and McNamara test, and also we're going to run the inter-rater reliability. The conclusion of our proposal is the therapy of working memory related to verbal, visual, and auditory language works successfully among stroke people. Because of the clinical needs of stroke people with aphasia and the prevalence of short-term and working memory impairments, incorporating related treatments through practice-based evidence is advocated.